Let's look now at the gross anatomy of the male reproductive system and work our way through to the physiology. If you look at the next slide, we have a sagittal section. This patient has been cut down the middle by the artist, but the artist has cheated a little bit. If you look down here, we have the section going straight through the anus and straight through the middle of the penis, which would be a perfect mid-sagittal section. But then you wouldn't see the testicle normally because there's one on each side, and certainly you wouldn't see the cord going up. And so this artist has given us a three-dimensional view for clarity. The right side has been taken away, and we're theoretically looking at the left side in what is partially a mid-sagittal section. Let's go and look at this from the outside to the inside. Here we have the glands on section and the urethra going all the way up through and taking a turn and reaching the bladder and the prostate. It goes through the center of the prostate right above the perineum. Perineum being halfway between the rectum and the base of the penis. This picture also shows the foreskin in place here, which is just redundant skin going back to the edge of the glands. And here we have the scrotum. Scrotum, the word for scrotum merely means sac or bag. And this scrotum has several layers. It has the superficial fascia, which is a thickening under the skin, and it has smooth muscle in it that can contract and wrinkle and pull the scrotum up nearer the body for warmth. The reason this evolved is, for some unknown reason, the production of sperm happens to occur more at a temperature that is lower than body temperature by about 3 Fahrenheit degrees. That's the optimal temperature for the production of sperm. So the body has placed, and evolution has placed, the testicles outside the body where they may be cooled. But in very cold weather, or cold conditions such as water, in a lake, for example, the muscles can contract and bring the testes closer to the body for warmth. This can be a two-edged sword because body temperature is not good for sperm production, can cause abnormal sperm production, and can even lead to testicular cancers. There are cases when the testes fail to descend. Instead of coming from the abdomen and migrating through the inguinal canal and to the outside, we have something called cryptorchidism. The testicle is referred to as the orchid. Cryptorchidism is the hidden orchid, and sometimes these testicles are somewhere between the inguinal canal near the pubic bone and all the way inside the body. Now, as I said, this can lead to sterility. It can lead to cancer, so we like to bring these testicles down as early as possible. And the way we do this is either using a chemical, which is called a human chorionic gonadotrophin, which is given to the child, and this stimulates the further descent of the testes in some cases, or we can bring them down surgically if that doesn't work. So it's always best to do it by medication if you can, but this can be done by an operation. If the testicle is going to be brought down early in life, we like to do this for psychologic reasons very early in the child's life, or waiting until they're closer to puberty, because psychologically surgery on anywhere on the penis or testicles is perceived by the child as a really vicious attack and can have very disturbing effects on their psyche. So we tend to do our timing of surgery in this case based more on emotional, psychological issues than actually the physical issues. Spermatogenesis is the word referring to the production of the spermatozoa or the sperm cells, and that begins sometime around the age of puberty. If we look at the next slide, here's the anatomy of the testicle and the spermatic cord. This is where the cord has migrated down through the inguinal canal from a retroperitoneal position. It is outside the peritoneal cavity. We'll see that the female organs are inside the peritoneal cavity. And as you can see here, we have a muscle, a smooth muscle on the outside called the cremaster. It's seen in its entirety here. This is the muscle that can contract and pull the testicle closer to the body for warmth. It is an involuntary muscle. Some people have voluntary control and can actually raise the testicle at their own will. Inside the cord, we have a big plexus of veins here, and known as the pampiniform plexus, and then we have a single small artery coming down to supply the testicle. These veins can be a problem because they can develop swelling or become varicose veins, and sometimes the pressure they exert can suppress sperm production and make the man sterile or infertile, and this can be treated surgically. Those varicose veins can be removed. Now, when we look at what's going on more deeply in the system, this is a cutaway or a sagittal section of a single testicle. The other term is testis. Here's the blood vessels, the pampiniform plexus, and the spermatic cord. We have several layers here, and if you look carefully, it's very segmented. Outside, on the very edge, we have a thickened area called the tunica vaginalis and the tunica albuginea, which means white. These are very tough, fibrous protection for the testicle. They have great tensile strength, and they provide protection. And the testicle itself is divided into lobules and tubules. And what happens is sperm production begins down here in these areas and eventually moves into this network called the rete testes, and finally ends up in an efferent duct, efferent being away, and then moves out through this coiled duct here until we get the beginning of what is called the epididymis. If you look at this plane, it looks like an appendage attached to the testicle, which it is. It's called the epididymis, and it leads away and up through something called the vas deferens or the ductus deferens. In the spermatic cord, this is the place where we do vasectomy, when one of the most safe and effective methods of birth control is to remove a section of the vas. It's very accessible right under the skin. It actually feels different than the veins or the arteries. The urologist or the surgeon can feel the vas. It almost feels like a strand of spaghetti, something very hard within the soft vessels. And through a tiny incision under local anesthesia, this can be brought out. It can be cut, a section removed, the ends tied, and that will stop the migration of any sperm that are left inside the testicle.